In this lecture, we will discuss about the anatomy of cranial fossa. This includes discussion of anterior cranial fossa, middle cranial fossa, posterior cranial fossa. What are cranial fossa? The cranial fossa are depressions in the floor of the cranial cavity that house different regions of the brain. What are the types of cranial fossa? The cranial fossae are divided into three regions: anterior cranial fossa, middle cranial fossa, posterior cranial fossa. Each fossa contains specific anatomical landmarks and accommodates distinct brain structures. We will discuss them one by one. Number 1. Anterior cranial fossa. It is the most shallow and anterior part of the cranial base. Bones involved in anterior cranial fossa: frontal bone, ethmoid bone, lesser wings of the sphenoid. Boundaries of anterior cranial fossa. Its anterior boundary is formed by the frontal bone. Its posterior boundary is formed by the sphenoid ridge and anterior clinoid processes. Number 2. Middle cranial fossa. It lies deeper and more centrally, posterior to the anterior cranial fossa. Bones involved in formation of middle cranial fossa: sphenoid bone, its body and greater wings; temporal bones, its petrous part; parietal bones are involved partially. Boundaries of middle cranial fossa. Its anterior boundary is formed by the sphenoid ridge. Its posterior boundary is formed by the petrous ridge of the temporal bone. Number 3. Posterior cranial fossa. It is the deepest and most posterior part of the cranial cavity. Bones involved in formation of posterior cranial fossa: occipital bone, temporal bones, its mastoid part, and petrous parts. Parietal bones are involved partially. Boundaries of posterior cranial fossa. Its anterior boundary is formed by the petrous ridges. Its posterior boundary is formed by the occipital bone. What is the clinical significance of cranial fossa? Fractures of cranial fossa. Fracture of anterior cranial fossa may cause CSF rhinorrhea due to cribriform plate damage. Fracture of middle cranial fossa is the common site for basilar skull fractures. It may affect cranial nerves and vessels. Fracture of posterior cranial fossa is rare, but severe, can compress the brainstem. Tumors in cranial fossa. This involves pituitary adenomas in the sella turcica, acoustic neuromas near the internal acoustic meatus. What are herniation syndromes? In this case, increased intracranial pressure may force brain tissue through the tentorial notch, or foramen magnum,